Hi, I'm Kate Tononi. I'm a physical therapist assistant at Loudoun Sports Therapy Center. Today I want to talk to you about a condition called runner's knee. It's also called patellofemoral pain syndrome. So I want to start by going over the anatomy a little bit. So your patella is also known as your kneecap. And this is your patellar tendon, which comes down from your quadriceps, your thigh muscles, and comes down and inserts here onto your lower leg bone, which is your tibia. This is your femur, which is your thigh bone, hence patellofemoral pain syndrome. So what happens with this condition is that your patella or your kneecap is not tracking properly. So normally it should slide and glide up and down and slide and glide side to side. So when we're testing somebody who has knee pain, we often find that the patella is tracking laterally to the side due to tight connective tissue, or it can also be caused by a decrease in wear down of your cartilage, which can happen over time. It happens with athletes, but it also happens with people who are sedentary. Another name for runner's knee is also called moviegoers syndrome. People who sit a lot all day, office workers, puts a lot of stress on your knee. So if you're constantly sitting with your knee bent, puts a lot of stress on the knee joint. So one way that we test for patellofemoral pain syndrome or runner's knee is we're going to have a patient demonstrate a squat for us. And you can see as she's squatting down, you can see that her femur, her thigh bone, is coming in, and then her lower leg bone, her tibia, is coming out. So we can tell there's tightness here in the connective tissue, and there's also weakness in the hip that won't allow to pull her knee into proper alignment. Another way to test for this is to do dynamic knee valgus test. So she's going to jump up onto the plyo box. So you could see during her takeoff, her knees collapse inward, and also during her landing, her knee collapses inward. Now, left untreated, this can lead to additional injuries such as an ACL tear. So this is something that you definitely want to address. So now my patient is going to demonstrate the proper form. So her hips, her knees, and her toes are all going to be in proper alignment. So you can see her hips, knees, toes, everything is in alignment. If you're having any type of knee pain, be sure to give us a call at Loudoun Sports Therapy Center at 703-450-4300. Also be sure to check out our Healthy Tips blog and our videos on our website. It's www.loudonsportstherapy.com. And we're also on Facebook, so be sure to like us on Facebook. And come on in and take care of those knees. Have a great day.